Tonight, big questions about the future of Florida's long-term care industry. Skyrocketing costs and historic staff shortages are forcing many facilities to stop taking new residents. ABC 27 investigative reporter Katie LaGrone reports on the devastating realities of an industry so many Floridians depend on.
Nearly 2 years after the COVID-19 virus invaded, wreaking its initial wave of havoc on the sick, elderly, and vulnerable, the industry relied upon to care for them is in a full-blown crisis. Costs up, revenues down, and new workers are becoming almost impossible to come by.
I've never seen it this bad.
I'm extremely worried.
Luke Newman of Palm Garden Healthcare helps operate 14 nursing home and assisted living facilities across the state, with each one down roughly 10% of its staff. The implication of an industry-wide staff shortage, historic.
In a few instances, yes, we've had to limit admission.
Every one of my members that I'm hearing from is, at some point they're having to look at limiting admission.
Has that ever happened before?
I have never seen it in my almost 14 years working at Florida Healthcare. I've never seen it this bad.
According to Kristen Knapp with Florida's Healthcare Association, the state's leading association for nursing homes, the staffing crisis has left facilities with no other choice but to fill voids with temporary workers who lack consistency with residents and can cost facilities double, even triple in hourly pay.
It's unsustainable. You've got some staff members who are leaving the facility and going to work for the agency, getting paid more by the agency, and then the agency is sending them back to that building. That doesn't bode well for staff morale.
It's a problem raising new questions about price gouging. Since long-term care is a service, not a product, there are no laws on the books stopping agencies from charging what they want.
We're losing staff to industries where jobs are easier and the pay is higher.
In Tallahassee recently, industry members pleaded with lawmakers for help.
I love this industry, but I'm really afraid of what the future holds.
At Palm Garden, much like many facilities, they are now offering more money, paying staff members to go to school, even earn nursing degrees. But for an industry that gets paid by the government, the question remains how long it can keep operating without the government stepping in to save it.
The future of long-term care in Florida and nationwide is in jeopardy. It cannot persist as it is now.
This Monday, leaders from hospital groups and long-term care facilities will be gathering in Tallahassee as part of a roundtable. Its focus, how to get younger people interested in this industry and keep them. Katie LaGrone reporting.